one of our key strategies is to expand testing in Africa. And our initiative for partnerships to accelerate COVID-19 testing has a target of testing 10 million Africans by the end of October. And we are well on that path. We are doing just above 3 million right now. To expand testing properly, we need to make sure that the infrastructure at country level is decentralized from the capital cities into the regional health facilities so that more and more people have access to testing facilities. Secondly, is to make sure that we have test kits available. These have become more and more difficult to find because everywhere in the world, everyone is looking for the test kits. But as Africa CDC, we are doing everything we can to make those available to member states. Third is we must do targeted testing, not to test everyone, not mass testing per se, but it is to target your testing so that every test is counting. That way, we'll be able to get more who are affected, and using the ones that have been testing positive, we can be able to trace their contacts and test those ones as well. So it needs to be very well structured in terms of a strategy so that we test those who need it and not just test everybody. Finally, is we released recently guidance on use of rapid tests. And these we are using for surveillance so that we can be able to have even more targeted testing for PCR in the laboratory. These are some of the things that we are doing as Africa CDC to expand testing in Africa, because that's the only way we'll be able to know our exact burden and therefore prepare appropriately. Some of the things that need to be done is personal discipline. I like saying that we are the vaccine. It is what we do that is going to interrupt the transmission. Second, in terms of the next steps, we must strengthen our health systems, and not just hospitals and infrastructure, but also the numbers and the capacity of the healthcare workers need to be improved so that we are ready for the next pandemic when it comes. And finally, we must be able to provide correct and timely information to members of the public. That way they know what they need to do, when they need to do it. And that discipline is what is going to ensure that we can be able to tackle any type of illness that will be seen within the population. Personal discipline and improving the health system through infrastructure and capacity building for health workers.